the ethics and the transparency to be able to tell a patient that actually AI has made the decision about your care, it opens a minefield.
Today's session is part of our Thought Leadership Initiative, From Silo to Synergy, Redefining Healthcare Research Ecosystems. We are honored to be joined by Dr. Nikhil Pawa, Consultant Colorectal and General Surgeon at Chelsea and Westminster Hospital, NHS Foundation Trust, who also serves as a Principal Investigator on multiple clinical studies within the NHS.
Thank you very much for the invitation. I look forward to the discussion.
How can we ensure that research remains patient-centered while still benefiting from the scientific rigor and ethical oversight that clinicians bring?
The minute you have an idea for a research project, you've got to keep thinking to yourself, is this really something that, where can I involve the patients from the very beginning? The problem that comes is, and I think it's a dichotomy that we all struggle with, is there's still so much paternalism in medicine. And however much you try, how can you rid that? I mean, how can you sit somebody down and talk to them about every single nuance of cancer care and treatment and chemotherapy and the benefits of this drug and that drug when their knowledge is not going to be of that area? So there's always going to be an element of paternalism, not only from the doctors. There's always going to be an element of paternalism that some patients want. They want that ability to be able to say to you, I just want you to tell me what I should do, or I trust your judgment on this, or whatever. So that's difficult, finding that, and then being able to then try to minimize that when you design some form of research, and trying to get the right sort of participation from patients from the early outset.
How do patient feedback mechanisms, like surveys, advisory boards, forums, qualitative, quantitative data, help shape the future of research and service delivery in your field?
You have to keep reflecting. You have to keep stopping. You keep having to go back and look at your service, look at your pathways, look at the patients and say, right, am I delivering the best possible thing I can do? We recognize resources are limited, particularly within sort of National Health Service. We recognize that things are ever changing. The volume of patients, the staffing levels, the availability of certain things such as investigation resources or pathology or imaging and things like that. So you've got to keep going back and looking at those things. And also within that, on a national level here, we have targets that are ever changing as well. So we are expected to meet those targets. And so whilst that is not the sole aim of developing or delivering a service for patients, it is obviously something that we are measured against. Those KPIs, that's a central one that we have to constantly try and adhere to meeting. So these are sort of stimuli to keep getting you to stop and say, okay, let me just have a think about what I can do different.
How do you think technology, AI, and patient data will reshape collaboration and research ethics in the coming years?
We know that AI is moving towards being able to make good algorithms for decision making, and so for cancer treatment, for instance, you'll be able to plug in the information and it will give you an evidence-based decision to say this is the next stage, or chemotherapy or radiotherapy, surgery, whatever it is, for this patient. So I think that's quite interesting. The problem that occurs, as always is the case within things like healthcare, is that technology comes along, developments come along, changes come along, they all get integrated and introduced at such a rapid rate, and then suddenly scurrying behind us, the legal and ethical teams go, hold on a second, I think we might need to adjust our protocols here a little bit. But having said that, there are amazing tools for data collection, for data processing, for collation of information, where for research, AI will be groundbreaking in the ability to be able to help with that data analysis, that data collection, that ability to offer communication with patients if they need advice or what have you, to be able to direct things. All of that stuff, the streamlining that will exist for research applications, for collation of data and analysis of data and interpretation will be phenomenal.
Excellent. Thank you for that specific example. We really appreciate it.